So you want to lower your risk of cardiovascular disease? Eat fish. This presentation is going to be on how omega-3 polyunsaturated fatty acids affect genetic susceptibility to cardiovascular disease. So cardiovascular disease is actually a blanket term. It's not just one disease. It's any disease that has to deal with the heart and, like arteries and blood vessels and all that kind of stuff, anything that affects the heart. So some forms of cardiovascular disease are coronary atherosclerosis, also coronary heart disease. Those are kind of the same thing. High blood pressure, cardiac arrest, which is a heart attack, congestive heart failure, arrhythmia, peripheral artery disease, and a stroke. And so the pictures that I have down here, the one on the left is when you have a blocked coronary artery caused by atherosclerosis, which we'll talk about in a bit. This can cause, as we see, tightness or pain in the chest, which is a sign of heart failure, cardiac arrest, a heart attack. And then on the right is going to be your stroke, when there is an artery breaking open in the brain, which causes brain bleeding. And then the pressure of the blood on the brain causes brain tissue death, leading to a stroke. So who exactly is at risk for developing forms of cardiovascular disease? So some risk groups include men in general, people aged 55 and up, those with high cholesterol, people with unhealthy eating habits overall, overweight people, those with diabetes, people who smoke, and most importantly for today's presentation, and most importantly in general, is people who have cardiovascular disease running in their family in terms of heredity. So actually approximately 40% of the risk of cardiovascular disease lies in hereditary factors. So it's a very big chunk comes just from whether someone in your family has a history of cardiovascular disease. So especially for people who have that in their family, they need to do something from a young age to prevent themselves from also going down that path, because it's very likely that it will also happen to them if they don't. So you might be asking, what can be done to lower your risk, especially if you are one of those people? So the answer is omega-3 polyunsaturated fatty acids. It's the key to lowering your risk. So what are omega-3 polyunsaturated fatty acids? These are anti-inflammatory fatty acids that are obtained through your diet, from the foods you eat. And so the sources include oily fish, nuts, and plant oils. For this presentation, we're going to be focusing heavily on the oily fish aspect of omega-3 polyunsaturated fatty acids. But some of the functions in the body of these fatty acids include the regulation of blood pressure, nervous system functioning, glucose tolerance, and importantly for today's purposes, decreasing the growth rate of atherosclerotic plaque, lowering risk of cardiovascular events overall, as well as cancer. So fish oil, coming from the oily fish, and also can be found in supplements, fish oil supplements. So fish oil contains 2 long-chain omega-3 polyunsaturated fatty acids, these being eicosapentaenoic acid, or EPA, and docosahexaenoic acid, also known as DHA. And as you can see here, I put the structures. They're very, very similar in structure, the only difference being that DHA has an extra 2 carbons and thus an extra 2 hydrogens. That is the only difference. They are very similar fatty acid chains. But together, DHA and EPA are shown to reduce inflammation and improve hypertriglyceridemia, otherwise known as high blood triglyceride levels, which is very, very important for the purpose that I'm discussing here, lowering your risk of cardiovascular events, because a lot of them originate in these high blood triglyceride levels, leading to high cholesterol. So the consumption of EPA and DHA, lowering your blood triglyceride levels, is very important here. So one of the cardiovascular events that I mentioned earlier, that I'm going to go into more detail about here, is coronary atherosclerosis, which is an inflammatory disease and a lipid metabolism disorder where plaque is formed in the walls of an artery. So as you can see on the left here, we have a normal artery, and then on the right is where the lipid deposit of plaque comes in, and that narrows the artery, causing high blood pressure. And eventually, if the artery becomes too narrow, there will be a blood clot, and that can lead to several things, including cardiac arrest, heart failure, obviously, several other things can be a result of this. So in more detail, coronary atherosclerosis is when high levels of LDL cause LDL penetration underneath a blood vessel. And so this extra LDL causes foam cells or cholesterol-filled macrophages to be formed, which leads to plaque accumulation in the artery. As plaque levels rise and the artery narrows, the risk of cardiac arrest greatly increases. Once enough plaque accumulates, thrombosis or blockage of an artery will occur, which can lead to a stroke or a heart attack. And high triglyceride levels, as we mentioned before, otherwise known as hypertriglyceridemia, these are markers for atherogenic lipoproteins and thus contribute to the hardening of the arteries. As mentioned, fish oil is shown to lower blood triglyceride levels, as well as increase beta oxidation of fatty acids, which is the mechanism that oxidizes fatty acids to become energy. So we want that to happen, obviously, and it reduces inflammation as well. DHA and EPA also serve as ligands for PPARs, which regulate gene expression, encoding the proteins for fatty acid metabolism, and then in the formation of VLDL, which is really important, very crucial to lowering blood triglyceride levels, because VLDL carries the triglycerides from the liver to the periphery cells, thus making the levels of triglycerides in the bloodstream lower. So obviously, after hearing all of this, we can come to the conclusion at the bottom here that increasing your levels of DHA and EPA overall increases, I might have said decreases, increasing levels of DHA and EPA decreases your risk of atherosclerosis overall. And a lot of the other cardiovascular events that we discussed earlier also follow these themes. Here I'm only discussing atherosclerosis, but a lot of these other cardiovascular events follow the same theme. So we can come to the conclusion that overall, consuming DHA and EPA decrease the risk of several of these cardiovascular events, atherosclerosis being one of them. Also, cholesterol plays a role. So the LDL that we just discussed in the last slide is a lipoprotein, a low-density lipoprotein that is made mostly of cholesterol. And so the extra LDL causes high cholesterol, obviously, forming those macrophages that cause the plaque accumulation in the arteries. So what DHA and EPA do here is they suppress the production of a hepatic apolipoprotein B100, which causes cholesterol levels to decrease. Because apolipoprotein B100 is a form of LDL that, when mutated, can cause hypercholesterolemia, which is a form of high cholesterol that is inherited hereditarily through your family for genetics wise. This detail is very important to this presentation because the genetic susceptibility part, where if you come from a family that has a history of cardiovascular diseases and you need to take action from a young age to do things to decrease your risk of inheriting those diseases, consuming DHA and EPA clearly, as we can see here, is very beneficial, because if you have less apolipoprotein B100 production early on, you have way less of a chance of developing hypercholesterolemia, even though it may have appeared in your lineage. So there's also some real life evidence for this claim. For example, the Eskimos in Greenland, their diet, just based on their geographical location, they're limited to what they can eat. So their diet consists largely of fish, seal, other seafood, stuff like that. And it also lacks in complex carbohydrates, fruits, and vegetables. So this diet is seemingly high in saturated fat content and cholesterol, but yet when looked into, they came to the conclusion that these people actually had significantly lower serum cholesterol and triglyceride levels than people in the United States. So you can kind of come to the conclusion that the large quantity of omega-3 polyunsaturated fatty acids in their diet, because they're eating so much of the oily fish and seal and seafood, provide these health benefits, and then through that protect them from cardiovascular events, which is very different from the people in the United States, because the Eskimos, as I said, excuse me, have not as much access not as much access to different types of food. They mostly can get their hands on fish and seafood, just based on the way they live and where they live and that kind of stuff. So even though their seafood is giving them a lot of saturated fat, which would usually result in high cholesterol and other negative health outcomes, it actually results in a lower blood cholesterol and lower blood triglyceride levels, just simply because of the omega-3 polyunsaturated fatty acids, which is really amazing. A scientific study that can be used to back up this claim is the DART study, which in 1989, it's the Diet and Reinfarction Trial, which is called DART. It was conducted, and during this study, it was found that consuming oily fish or fish oil supplements reduced 2-year all-cause mortality by 29%. And this was almost entirely attributable to a reduction in coronary heart disease mortality. And there was a particularly impressive reduction in those who took fish oil supplements, as opposed to only eating fish in their diet, suggesting that the more direct source of DHA and EPA did a better job. That is not to say that if you can't get your hand on fish oil supplements, or even if it's just easier for you to consume oily fish, that's not to say that you will be any less healthy. This study is just showing that a more direct source of these two omega-3 polyunsaturated fatty acids did a slightly better job at lowering mortality rates in people who already had cardiovascular disease. So this study can be used to draw the conclusion that for people who don't have cardiovascular disease, or don't have it but have it in their family, using implementing DHA and EPA directly, if possible, through fish oil supplements is the best way to reduce their risk. So at this point, you may be asking, what do you recommend for someone who's worried about developing cardiovascular issues for whatever reason? And for that, I would say that fish oil supplements containing 1,000 milligrams of combined DHA and EPA are recommended daily to patients dealing with cardiovascular events currently, such as coronary heart disease or heart failure. And then 2 oily fish meals per week, which contain approximately 500 milligrams of combined EPA and DHA, are recommended for people at low risk by the American Heart Association. And then specifically for those with hypertriglyceridemia, 2 to 4 grams of EPA and DHA can lower triglyceride levels by 20 to 40%. So not saying you need to have that much in one sitting, because that's a lot, but if you use EPA and DHA regularly, these are the results that you will likely see, as found by the American Heart Association. So, as I mentioned before, the most easy way to reduce your risk, in simpler terms, obviously, it's to include these polyunsaturated fatty acids, the omega-3. But in simpler terms, just eat fish if you can, like eat oily fish like salmon or mackerel, and try for twice a week. That is the best way, the best and most delicious way to lower your risk. So in conclusion, everyone, especially those with familial history of high cholesterol, high blood triglycerides, and or any form of cardiovascular disease should be implementing adequate levels of omega-3 polyunsaturated fatty acids into their diet. There is increasing evidence showing that by doing so, you will significantly lower your risk of several forms of cardiovascular disease.